Here's the surprising part of mental health history. Long before brain scans, therapy offices, or the DSM-5, ancient Egyptian healers were already describing emotional suffering as real, physical, and treatable. Around 1550 BC, a medical scroll now known as the Ebers Papyrus was written in Egypt. More than 3,500 years later, it still feels strangely familiar. Not because the Egyptians understood anxiety like modern psychiatry does, but because they noticed something medicine still depends on today. Fear does not stay in the mind. It speaks through the body. In the 19th century, ancient Egyptian medical papyri began reaching European collectors and scholars. Edwin Smith, working in Luxor, became linked to one of the most famous surgical papyri. Georg Ebers later acquired the Ebers Papyrus, one of the largest surviving records of Egyptian medicine. Inside it was a section often called the Book of Hearts. To the Egyptians, the heart was not just a pump, it was the center of thought, feeling, movement, and life. So dread, sadness, agitation, weakness, or inner disturbance could be described as a problem of the heart. That may sound primitive at first, but think about anxiety. Where do people feel it? In a racing heart, a tight chest, shallow breathing, a restless body, a turning stomach, and a mind that cannot settle. Modern psychiatry uses different language. The DSM-5 describes anxiety disorders through excessive fear, worry, avoidance, physical tension, sleep disturbance, and trouble functioning. Clinicians now separate diagnoses like generalized anxiety disorder, panic disorder, and phobias. We have research, medication, psychotherapy, and clinical guidelines, but the continuity is striking. Ancient Egyptian texts did not give us a modern diagnosis of anxiety disorder. They recorded something older, the lived experience of distress. Their treatments blended observation, ritual, herbs, words, touch, and spiritual meaning. Modern care is different. Today, anxiety treatment may include cognitive behavioral therapy, exposure-based approaches, breathing skills, grounding techniques, lifestyle changes, and sometimes medication tested through research rather than assumed from tradition. And yet, one theme survives. The anxious person needs help returning from imagined danger to present reality. The Egyptians framed that journey through the heart.
Modern psychiatry frames it through the nervous system, cognition, behavior, and environment. Different maps, same human storm. That is the real historical echo, not that ancient Egypt secretly had the DSM or that papyrus replaced science, but that careful observers, thousands of years ago, saw the link between emotional pain and physical symptoms. Modern psychiatry transformed observation into evidence, but the first clue was already there. Written on papyrus, human suffering has always asked to be understood.